Personality disorders. Personality disorders are pervasive, maladaptive, and chronic patterns of behavior, cognition, and mood. Persons who have personality disorders experience distorted perceptions of reality and abnormal affective responses, ultimately manifesting in distress across all aspects of the individual's life, including occupational difficulties, impaired social functioning, and interpersonal hardships. Patients with personality disorders often have little to no insight in regards to their maladaptive behavior. Rarely do they voluntarily present with personality disorder or personality issues as their chief complaint. More often than not, the patient will present secondarily to psychiatric sequelae of the underlying personality disorders. Thorough personal and social history accompanied by collateral information will lead the clinician towards accurate diagnosis and treatment. Collateral information is paramount in the deduction of an accurate diagnosis, as those closest to the patient will have significant insight into the patient's behavioral patterns. Families of individuals with personality disorders will often provide the impetus for the patient to seek medical attention. The greatest correlation between a family history of schizophrenia and a personality disorder is seen with schizotypal personality disorder. Patients with borderline personality disorder experience out-of-body sensations called dissociation during periods of heightened stress. The morphology of the histrionic personality disorder originated from the term hysteria, which was associated with conversion disorder. Histrionic patients are usually attention-seeking, overly concerned with physical appearance, attempt to be the center of attention, find difficulty engaging in meaningful relationships, and come across as sexually promiscuous. Narcissistic personality disorders, in accordance with the Greek myth of Narcissus, who fell in love with his own reflection, suffer from self-centered, egotistical grandiosity. They tend to lack empathy, are overly sensitive to evaluation by others, exaggerate accomplishments, and display a sense of entitlement. Personality disorders can either resemble or coexist with other psychiatric illnesses. Most commonly confused is the distinction between borderline personality disorder and bipolar disorder. Borderline personality disorder is present with more transient shifts in mood in response to interpersonal dilemmas, whereas bipolar disorder is identified with more prolonged mood changes.